One, two, three. scholars all in the back. That there. Okay. And could I have one of the hostess please bring us some programs up here, please?
It is important that we at Tennessee State University and we around the world understand the accomplishments of Dr. Watkins and how that may impact the future of young people who may use him as a role model. Particularly, the program at Tennessee State University is unique. It is named for him. He walked the campus of Tennessee State University. He became a very internationally known cardiologist. We think that students that we bring to the program and we recruit, with their understanding of what he became, having its roots here at Tennessee State University, will be able to go forth and understand that they too can be successful and they will spread their wings from the roots that he started here so that they can emulate his accomplishments.
I had been exposed to Dr. King and the whole civil rights movement. I was looking at what was happening at Hopkins, which was not too different from Alabama, to be honest. And so I was getting outspoken about what we should do about black medical students, interns, residents, faculty, and so forth.
But you know what? My heart goes out to my students. Y'all know I've been at Hopkins 43 years. I gave my best.
Please receive our scholars this evening. Ms. Hopkins.
It doesn't move. Good afternoon, university administrators, faculty, staff, fellow students, family, friends, and special guests. I am Ethan Lord from the Houston, Texas, a proud Cohort 3 scholar with the prestigious Dr. Levi Watkins Jr. Institute Accelerated Pathway Program, and I'm honored to introduce the 8th President of Tennessee State University, Dr. Glenda Baskin Glover. Dr. Glenda Baskin Glover serves as President of Tennessee State University, a position she has held since January 2013. Under her leadership as the university's first female president, TSU has experienced a significant increase in enrollment, alumni fundraising, research dollars, and academic offerings. Dr. Glover is a certified public accountant, an attorney, and is one of 2 African American women to hold the PhD CPA JD combination in the country. Her past employment includes high-level positions in the corporate sector, as she is among few women to rise to the heights to serve on corporate boards of publicly traded corporations. Currently, she serves as lead director of Pinnacle Financial Partners. In 2022, President Joe Biden appointed Dr. Glover to serve as vice chair of the President's Board of Advisors on historically black colleges and universities. Dr. Glover's prior board experience includes the Student Loan Corporation, a publicly traded subsidiary of Citigroup, First Guarantee Bank Shares, and the Linus Group Incorporated. On these boards, she served as either financial expert, chair of the audit committee, or chair of the compensation committee. Dr. Glover is a frequently sought keynote speaker on business and economics topics to audiences around the country at national conventions, professional associations, and community groups. Her educational development began as a student at Tennessee State University, where she majored in mathematics. After graduating with a Bachelor of Science degree, she pursued the Master of Business Administration from Clark Atlanta University. She then completed her doctorate in business from George Washington University and later completed her law degree from Georgetown University. Dr. Glover is a member of several professional, civic, and nonprofit organizations. She is also the recipient of numerous awards and honors, and recently received the prestigious Thurgood Marshall College Fund Educational Leadership Award as the 2018 HBCU President of the Year. Glover was also named to Essence Magazine's 2019 Woke 100 list of influential African-American women change agents and power players that also included First Lady Michelle Obama and Gayle King of CBS This Morning News. In 2013, she was named to Diverse Issues in Higher Education's prestigious list as one of the top 25 women in higher education. Dr. Glover also serves as the immediate past international president of Alpha Kappa Alpha Sorority Incorporated. Dr. Glover and her husband Charles are the parents of 2 adult children, attorney Candace Glover Datcher and Dr. Charles Glover II. They are also the proud grandparents of Langston Emmanuel Datcher, Lincoln Mathis Glover, Everett Miles Glover, and the twins Logan and Lena Datcher. Please stand to your feet and join me in welcoming to the podium our illustrious president, Dr. Glenda Baskin Glover.
Good afternoon. It is my pleasure to greet you at this Dr. Levi Watkins Jr. Lecture Series and White Coat Ceremony. Today is a special day on the campus of Tennessee State University as we recognize those scholars who have excelled, who are now preparing for careers in the field of medicine. I want to ask all the scholars and cohorts, all of you, would you please stand so we can give you a round of applause. You can turn around and wave to your audience. Good. Thank you. And thank you to the parents and family members who joined us today. Let me ask the parents and family members of these students, will you stand? Great. Thank you very much. We honor Dr. Levi Watkins Jr. for the role he played in advancing medicine, performing the life-saving research, and in fact, saving the lives through his invention. We're pleased to have join us virtually Dr. Annie Marie Garraway, the sister of Dr. Levi Watkins. She's a giant in her own right and made it possible by making a $500,000 contribution to get this program started. We thank her for her generosity and her commitment to your success. We're honored to have Dr. Cornelia Graves with us today, who is known internationally for her work in the all-important field of fetal medicine. In fact, Vice President Kamala Harris has expressed her congratulations to you for your commitment to perinatal treatment in minority populations. As our two student government leaders coming in, will you come sit in the front row? Our SGA President and Vice President, will you give them a round of applause? So today I'm excited to be with you and eagerly watch you as you become role models for other students who dream to be like you, and we welcome you here today, and we wait eagerly, with eager anticipation, to see you as productive members of the medical profession. Thank you, and God bless each of you.
Thank you, President Glover. Good afternoon, everyone. I first would like to say thank you to everyone for coming out to support our students here and the Dr. Levi Watkins Jr. Institute. Dr. Levi Watkins Jr. was a medical pioneer and a champion for equity and inclusion in the medical profession. The Dr. Levi Watkins Jr. Institute is a vehicle that takes a student from a dream to reality. I must acknowledge that this vehicle is powered by two very important individuals, President Glenda Glover and Chair Barbara Murrell. I cannot overemphasize the importance of their endeavor in continuing the work of Dr. Levi Watkins Jr. to increase the number of physicians and dentists to serve minority communities, our communities. President Glover, Chair Murrell, I must personally and publicly thank you for all your hard work and support. None of this would be possible without either one of them. So today, please join me in celebrating the legacy of Dr. Levi Watkins Jr., the Dr. Levi Watkins Jr. Institute, and our students in Tennessee State University. I would like to introduce one of our scholars, Miss Anna Nell. She will be introducing our speaker. Oh, no, I am sorry. She will be providing entertainment for us.
Hello, my name is Anita Chukwunelli. I'm from Belton, Texas, and I'm a part of Cohort 3, and I will be reciting a poem that I wrote called The Legacy of a Pioneer. In the heart of TSU, under skies so blue, we gather here, a diverse, steadfast crew, to celebrate a legacy so bright and bold, the Dr. Levi Watkins Jr. Institute, stories to unfold. This institute, a tribute so grand to a trailblazing heart in our homeland. Dr. Levi Watkins Jr., we honor thee for your courage, your legacy, your visionary decree. From TSU's halls, he did emerge with a purpose, a mission, a surgeon surge. The first to implant a life-saving device. In cardiology's annals, he left us advice. Not only a surgeon, his mission ran deep, championing justice, a treasure we weep. He fought for inclusion with brilliance and grace. Across medical education, he changed the face. Now we become scholars, thanks to your name, your life ignite comrades, and legacy still tend your flame. A collective of healers, we proudly proclaim, to follow in your footsteps, we raise our own aim. We stand clad in white coats, but they represent more than just a garment that we will adorn. It's a mantle of hope, of strength, of responsibility. On this noble journey, we seek new possibilities. Today we don our coats, resolute and pure, as members of a cohort, strong and sure. To heal, to serve, to make our stand, with compassion and knowledge, hand in hand. So let us not forget the paths he forged, the life he lived and dreams he urged. Courageously we commit to his purpose anew, with a vow to our people to see his legacy through. Thank you.
Now we will have the introduction of our speaker by Ms. Samantha Altador.
Good afternoon, everyone. My name is Samantha Altador, and I'm a member of the first cohort of the Dr. Levi Watkins Jr. Institute Accelerated Pathway Program. It is a privilege for me to introduce this year's White Coat Ceremony speaker. Dr. Graves graduated from Baylor University with honors. She then went on to receive her medical degree from the University of Arkansas for Medical Sciences and was a recipient of the Purdue Frederick Award for Excellence in Women's Healthcare. She completed her internship and residency at Vanderbilt University Medical Center and her maternal fetal fellowship at Vanderbilt University. During her fellowship, Dr. Graves received special training in obstetrical critical care and became the director of one of the first critical care obstetrical units in the nation. She previously served as the division director of maternal fetal medicine at Vanderbilt University, as well as assistant dean for diversity. She is currently the medical director of Tennessee Maternal Fetal Medicine and the medical director for perinatal services at St. Thomas Health Systems. She is a professor at the University of Tennessee and serves as a clinical and adjunct professor for Vanderbilt University and Meharry Medical College, respectively. Dr. Graves was the first African-American woman in the Department of Obstetrics and Gynecology, the first African-American president of the House Staff Council, the first African-American woman to be promoted to senior academic status, the first to serve in administration as an assistant dean, and the first African-American woman to direct a major division at Vanderbilt University. Considered an international expert in the management of maternal disease, Dr. Graves is extensively published and has received numerous teaching, research, professional, and community awards. She has been actively involved in research and has served as an investigator on studies involving asthma, cardiovascular disease, preeclampsia, HIV, diabetes, and drug addiction during pregnancy. She is an immediate past member of the Board of Directors of the Society of Maternal Fetal Medicine. She serves as a physician advisor to the Preeclampsia Foundation and as a peer reviewer for the Society of Maternal Fetal Medicine, the American Journal of Obstetrics and Gynecology, and the American Journal of Obstetrics and Gynecology Global Reports. Dr. Graves has been instrumental in the formation of a maternal mortality review committee for the state of Tennessee and currently serves as a member of the review committee and a member of the CDC Committee on Bias in Maternal Mortality. She also serves as the project leader for the maternal section of the Tennessee Initiative for Perinatal Quality Care. In 2012, Dr. Graves, along with Dr. Stacy Davis, a cardiologist, started the Collaborative Perinatal Cardiac Center, a joint venture between Tennessee Maternal Fetal Medicine and St. Thomas Health, which is one of the first in the nation to address maternal heart care from the preconception period through postpartum care with a focus on long-term prevention. In her spare time, Dr. Graves serves as a keyboardist and choir director for her church and works with the youth ministry. Would you all join me in welcoming Dr. Cornelia Graves to the stage?
I want you guys to know I have problems with podiums because we are about the same height. Well, good afternoon, everybody, and congratulations as you enter your journey into the field of medicine. I am honored that you have asked me to be your speaker for this event. I am delighted to stand to represent the legacy of Dr. Watkins, who I knew and admired. Today, it is important to remember those who have paved the way to make this day possible for you. So you are here, entering a profession that not only requires intellect, talent, and commitment, but a profession that is a calling. Healing is a divine gift, and it is important that you value and protect this calling. For if you entered this profession for glitz, glamour, money, or fame, these will soon fade away as you realize the study of medicine is a lifetime commitment to continuous learning. And while there are wonderful moments of joy, beauty, and a sense of accomplishment, there will also be times of sadness, loss, and desperation. As you accept your white coat, know that you have taken on a garment that demands the utmost professionalism, responsibility, and sacrifice. But if you truly embrace all that medicine can be, you will enjoy a life of purpose and of satisfaction. So, on this occasion, I've been asked to speak on maternal mortality. Well, being the daughter of a minister, I just tried to decide on a subject. So I thought of several. It started over 400 years ago. Is there any surprise? Often silent and unheard. You get what you pay for. There is hope. But then I decided, being the Gemini that I am, why not use all of them? So as I start, if you need a subject, maternal mortality. It started for black women over 400 years ago. So is there any surprise, as we are often rendered silent and unheard in a society that undervalues birth? So you get what you pay for, but there is hope. We all know the statistics. America has the highest maternal mortality rate of any industrialized nation, although we pay more on health care than any other nation. In 2021, the maternal death rate was 32 per 100,000, more than 10 times the estimated rate of any other developed nation. More importantly, this was a 40% increase from 2020. Much of this had to do with COVID, and the highest since 1965. But the stories for black mothers is more dire. In the same year, the rate for non-Hispanic black women was 69 per 100,000, which is a rate 2.6 times that for non-Hispanic white women. Maternal mortality for women over 40 was 138.5 per 100,000. But maternal mortality for black women over 40 in the United States of America was 300 per 100,000. This means if they had birthed in the Congo, 282 per 100,000, or Uganda, 284 per 100,000, the risk of death would have been less than birthing in this country. And while education, insurance status, and access to care or socioeconomic status may protect non-Hispanic white women from poor outcomes, we know this is not the case for black women. In fact, college-educated black women were 5 times more likely to die in childbirth than their equal counterparts. And in Tennessee, the maternal mortality rate was 34.6 per 100,000, which ranks us 4th in the highest in the United States. More importantly, Mississippi is better than we are. Now it is time for us to be embarrassed. In most cases, regardless of state, over 60% of these deaths were felt to be unpreventable. I know you're asking, how could this happen? Why are we just hearing about it now? But the truth is, this started over 400 years ago. Africans made the dangerous trip across the Atlantic to the Americas to provide free labor for landowners. For centuries, African women gathered to support their sisters, daughters, and friends during their pregnancy. The sacredness of birth was important to our community. They brought these practices to the New World and often shared their skills with their enslavers, not only assisting in childbirth, but breastfeeding their children as well. This practice of birth continued in our community for over a century. It was from 1801 to 1860 that black birth became a general concern of general society. And you probably ask why. Well, in 1801, the importation of slaves was outlawed. So the only way to get new slaves was to have black women give birth, who were here, give birth. The ability of black women to reproduce children to support the current system of slavery was important to maintain social structure. It was during this time that white doctors were sometimes called to support difficult births. However, granny midwives, the name applied to black midwives, continued to serve our communities into the 1920s and 30s, when the rising infant and maternal mortality rate and the desire to medicalize birth led to changes in practice. The once revered midwives were blamed for death rates, not decreased resources, not poor socioeconomic status, not to lack of access to hospitals or social policies, but the midwives. These women who had supported black and white births, especially in the South, and kept people as safe as possible were deemed the issue. The attack on the black midwife made black midwifery almost extinct for years in this country. But the medical system was not open to black or indigenous people. So is there any surprise that while we continue to improve care for majority populations as birth moves to hospitals, and the understanding of need for sterilization and an aseptic technique to prevent infection progressed, black and indigenous women were relegated to deliver in clinics or in separate wings that were not well supplied. In fact, as a child of the early 60s, I was delivered to an advanced maternal age mother in a rural but well-staffed clinic by a Meharry physician, even though my parents had master's degrees. My mother from Northwestern and my father from Tennessee A&I, which is now Tennessee State University. The nearest hospital that would admit a black woman for birth was located in Memphis, which is over an hour away. By the way, my brother was delivered in the same clinic a year and a half later. The structural and institutional racism still is seen in outcomes today. In 2019, Dr. Elizabeth Howell, who is one of my mentors, in her work showed that 40% of maternal deaths could be avoided in New York City if the delivery had occurred at a different hospital with higher resources. And is there any surprise that there is a distinct distrust of the healthcare system when we have been subject to historic incidents such as the Tuskegee Project, the Guatemalan Project, the cells of Henrietta Lack? Each incident, the profession whose motto is to first do no harm, denied treatment and failed to get informed consent. Is there any surprise that the distrust has been bred from the inception of the specialty of obstetrics and gynecology in this country? J. Marion Sims, the father of our specialty, perfected the art of rectovaginal fistula repair, which are injuries which are caused during childbirth, without the benefit of anesthesia, on enslaved women who could not refuse. And Surgeon Francis Provost pioneered C-sections in the United States, a procedure that was actually brought from Africa on enslaved bodies through repeated experimentation. These women were experimented on until they either died or were cured. It has been said the silent is the language of internalized depression. Research in maternal mortality suggests that often women of color who encounter the medical system feel unheard or seen. The result becomes a cycle. I express my complaints, you dismiss my complaints, therefore I say nothing. In 2023, the CDC conducted a study examining mistreatment in the care of birthing persons. Wanda Barfield, who is the reproductive director of the CDC, stated that when we are talking about mistreatment, we are talking about not receiving a response for requests for help, being shouted at or scolded, or not having our physical privacy protected, or being threatened with withholding treatment, or made to accept an unwanted treatment. About 20% of women in general had some type of mistreatment in the study, but it was higher for Black and Hispanic patients due to unconscious bias and racism. In addition, patients with Medicaid or with no insurance had the highest rate of mistreatment. These women these women were silenced, it led to the CDC establishing a campaign for patients and their advocates in 2020. Imagine we have to have a campaign to talk about Hear Her. The stories of Black women dying or having to push the medical system for care are too numerous to cover. However, it is important to name a few. Serena Williams, The international tennis star had to continue to request for care. When she complained of shortness of breath and chest pain, as she had had a pulmonary embolism in the past, and when she was sure she had another one, but no one believed her. When she told the provider she needed a CT scan and blood thinner, she was dismissed as being stressed after childbirth, being on too much pain medication. And when she persisted and finally obtained the CT scan, after much insistence, she was correct. Unfortunately, Serena's story ended favorably, but without her persistence, the story could have been different. There's Dr. Shanice Wallace, who was a pediatric chief resident at the University of Indiana, died 2 days after delivery due to complications of preeclampsia and HELLP syndrome. This death was deemed to be preventable. And then there's Kiara Johnson, who died at Cedars-Sinai from internal bleeding following a cesarean section. Her family has filed a civil rights suit against the hospital. She was left for more than 10 hours while family members pleaded with providers to pay attention to her symptoms. When she finally was taken back to the operating room, it was too late. At one point, her husband, the nurse even told her husband that she was not a priority. These are just a few stories of the lack of treatment, delay in treatment, mistreatment that have led to an increase in maternal mortality. In the United States, delivery and maternal care is paid for what we call in a bundle. They take all your care and put it into one payment. For routine obstetrics care, this pay may range from $1,500 to $3,400. And let me let you know that in Tennessee, a lay midwife can get $3,500 for delivery. In many states, Medicaid reimbursement for care is less than the actual cost of care. As hospitals and providers struggle with the costs, this leads to many smaller hospitals closing their doors on obstetrical care. This means that obstetrical care is often provided in larger city hospitals that can maintain profit with larger volumes. This leads to maternity health deserts in rural areas, decreasing access to immediate care and requiring patients to travel long distances for care, thereby increasing maternal morbidity and mortality. Tennessee is one of only 10 states. Tennessee is one of only 10 states. Tennessee is one of only 10 states who has not expanded Medicare under the Affordable Health Care Act, which also leads to decreases in access to care. One of the major issues is that most OB patients are no longer routine, and many pregnant patients are complicated by hypertension, diabetes, and obesity and need immediate care. I know you're thinking, Dr. Graves, this is not a great state of affairs. How do we change these issues and improve outcomes for birthing people in this country? Well, I'm glad you asked, for there is hope. We must be willing to discuss the structural and institutional racism that has led to many of the issues that face people of color. There's a maternal vulnerability index which looks at all these types of things for birth, access, food, income. And do you know the only county in Tennessee that is deemed favorable? Anybody can guess? Williamson. We cannot allow history to repeat itself. Poor housing, lack of transportation, food deserts, and lack of access to care. These issues have been generations in the making and will not be solved tomorrow, but can be addressed through understanding. Often we blame patients for their inability to navigate a system that is intended to be complicated and cumbersome. Addressing patients' needs, forming teams that consolidate services, and patient support will improve patient trust. We must investigate the causes of maternal mortality. I was recently honored to co-chair a joint project between the CDC and ACOG looking at discrimination and racism in maternal mortality. But my hope is that we will honor their lives by using the information that we find in these retrospective reviews, i.e. the patient has already lost her life, to address our issues in living patients to make preventable deaths rare. We must focus on health equity and bias in the healthcare system. Most organizations provide education on bias, but often follow-up and recognition is confounded by the fact that bias is so often embedded in our systems that we've even failed to recognize it. For example, we also often state things like, oh, we can't find diverse qualified candidates, or consider things that are run by women or people of color of lesser quality. We need to evaluate our patients and their families that when they encounter the healthcare system. I was attending a meeting and the presenter spoke of a black father who was approached by security in the hospital, detained because he seemed threatening. While others opened their mouths in horror, I hung my head in shame. As I recalled a similar incident that happened during COVID at our hospital. A prominent financial advisor went out to get his DoorDash for he and his wife, who was 29 weeks and confined to the hospital. He returned only to be stopped by the COVID screener who told him that he could not go back into the hospital because he did not look like he belonged there. We need to educate, to evaluate the effects of long-term stress on pregnancy. In 1992, Geronimus theorized that black and other women of color age earlier and faster because of the weathering of a lifetime of racial discrimination, institutional bias, sexism, and oppression. Her research demonstrated that the optimal age for pregnancy in black women was actually in their late teens, while, however, non-Hispanic black women had better outcomes in their mid-20s. Data suggests that heart disease begins 5 years earlier in black and Hispanic women, and insulin resistance 11 years earlier. These are important facts when we counsel our patients regarding delaying childbirth, and we need to stop shaming women who have elected to have their children earlier. We must begin to see the birthing years as part of the healthcare continuum. As a maternal fetal medicine specialist, we often see pregnancy treated as an isolated event. However, we know the biggest risk factor for a poor pregnancy outcome is a poor pregnancy outcome. We need to be aware that pregnancy opens the window to the future for diabetes, heart disease, and kidney disease, and there has been little research in that area. Now, I will say that Tennessee has done one thing, that we have expanded our care to 1 year after pregnancy, and much of this work is due to the hard work done by Vice President Kamala Harris. We must be advocates. I distinctly remember in the 2020 election, some of my friends stating, well, how bad can it be? Well, now we know. In 6/24/22, the Supreme Court overturned Roe versus Wade, and the right to serve termination of this pregnancy was no longer the rule in this country. Now, I'm not here to debate the moral or the political value of elective termination of pregnancy, but I am here to raise my voice for the number of women who need to terminate their pregnancy for maternal or fetal reasons, and for women who often do not have the resources to travel out of state. Every day, I perform genetic testing in my office. Often, these results are not favorable, and the fetus has little chance of long-term survival. However, since there are no options in Tennessee, I must send my patients to Illinois and Maryland for care. Several years ago, I took care of a mother who had multiple medical issues, including kidney disease, high blood pressure, and was on 5 medications. In fact, her mother had died at the age of 39 from these complications. We delivered at 32 weeks, and we thought it was a victory, and the baby did well. She became pregnant, and because we could not state that her chance of death in pregnancy was greater than 50%, few things are, she had to go out of state. We must learn to work together. Data suggests that maternal outcomes in communities of color are improved when we return to our roots. We must understand the role of midwifery. We must understand the role of doulas. We also must work with therapists and other mental health providers to understand the role of substance abuse and depression in our country. We cannot solve all of these working apart, but we must work together and explain and use our collective expertise to solve these problems. Last, we must think outside the box and address the increasingly complex medical population that we care for. It has been suggested that training in critical care obstetrics and maternal physiology could help with improving outcomes. Hence, it is now time for my story. I once stood where you are right now, receiving my white coat at the University of Arkansas. I decided to do my residency at Vanderbilt. At the last moment, it was my last interview. I knew during my residency I wanted to subspecialize in maternal fetal medicine, which will require 2 more years of training after 4. But this time, my focus changed. Vanderbilt wanted to start an OB critical care unit and needed someone to be the medical director. My mentor, Dr. Frank Boehm, sent me to the SICU. They had never had an OB fellow that was trained in obstetrics. It turned out to be one of the best decisions in my life. It was here I realized that we could change care for patients with pregnancy complications. It would be years later when one of the main obstetricians in this city came up to me, and now I need to remind you, when I finished my residency, this same obstetrician wanted to hire me, but he was concerned about how his patients, his white patients, non-Hispanic black patients, would receive a black doctor. But on this day, he stated, I nominated you for the Vanderbilt Alumni Award because I feel you've done more than anyone else to raise the standard of care for obstetrics in Nashville. I tell this story not to uplift my accomplishments, but to remind you of the legacy of Dr. Levi Watkins. Despite the times and obstacles, he was able to succeed and change the course of care for heart patients all over the world. He did it by striving for excellence, retaining his authenticity, and not being afraid to speak truth to power. The maternal mortality crisis is just one example of the multiple healthcare disparities in medicine. We have the power to change and improve care for all. There's excellence in this room, and there's activism in this room. And on this day, as you receive your white coat, you have accepted the challenge. It is now time for you to move forward and to fulfill your dreams. I thank you for your attention.
Thank you, Dr. Graves. I want to say it's very important, not only for our students, but for all of us to see and interact with a physician such as yourself who's committed and dedicated to serving minority and underserved communities. That's very important. Thank you. If everyone would direct their attention to the screens on the left and right, we will now have a video presentation.
After we had the honor of meeting Dr. Levi Watkins, it was just unnatural to want to establish a program, an institute in his honor. And so we came up with, I met with the team, we came up with the idea of establishing this institute and to bring students to TSU. For 3 years at TSU, the final years to be at the med school to which they will apply. And it's so important to me that this is a part of the legacy that I want to leave at TSU, that we thought we would do what we could to help our community. Because we know that our community relates better when they see one of us, and it gives them a choice. And because the qualifications are there, the care and concern are there. And so to leave a legacy where we produce doctors and dentists to help not just the Black community, but people of color and others who wants to be helped, is just so special to me and so important to me.
I aspire to become a surgeon, and I really hope to accomplish helping those who need help. So I really just want to help people. I think I was in middle school when I decided I wanted to become a doctor. Originally, I wanted to be a veterinarian, but I decided I couldn't hurt animals like that. So I decided it would work better if I was working with humans, and my dad's a doctor, and so was my uncle. He was an orthopedic surgeon. So that kind of led me to it when I would hear about their stories and surgeries. I found out about this program through my aunt who actually works here, and TSU was my top choice even before I heard about the program. I'm a legacy here. I'm fourth generation. I've had over 30 family members come here, so it was really a no-brainer. But then when I heard about the program and applied and got in, it was kind of like the trail.
I want to become a psychiatrist in order to give young Black, mostly girls, but children in general, the opportunities to seek help that I did not have. As a child, I've always been fairly determined and argumentative, in a way. So due to that, my parents and family members in general always told me, oh, you should be a doctor, you should be a lawyer, and I chose doctor. The thing I like most about being a scholar in the Dr. Levi Watkins Jr. Institute is the familial aspect of being a cohort model, because I never feel totally alone like most people would during their college transition.
In the future, I aspire to be a trauma surgeon, preferably in my hometown of Houston, Texas, and I hope to become and accomplish being the best trauma surgeon, nationally renowned, world renowned, whatever it may be. I just want to be the best at what I do. My mom has always said that she knew that I would be a doctor. She just said I had to realize it. So first, I wanted to be a crime scene investigator. And then I learned what they actually did. And then someone introduced me to the show Grey's Anatomy, and that kind of, opened my eyes to the world of medicine. And ever since then, this is probably, I want to say 6th or 7th grade. So ever since then, it's just been my dream and what I wanted.
I aspire to become an orthodontist, and I hope to bridge the gap in healthcare, in particular oral healthcare disparities in African American communities. And I want to open my own practice and provide quality healthcare to all demographics. I knew I wanted to become an orthodontist in middle school, so maybe 12 or 13. And the orthodontist was always a very warm and welcoming place. And also my personal experience with orthodontic treatment and just the confidence that it brought me, I want to provide that same gratitude and gratification to others.
I definitely want to become a neurosurgeon, and I want to work at a teaching hospital just because I think it's important to go back and teach younger people, and just the opportunity to also learn from peers as well. I think I was about 6 or 7 when I decided to become a doctor, and I just came from seeing my Uncle Jimmy. He was a family physician. I think he still is, honestly. I'll have to check on him, but just seeing him growing up, seeing that switch between uncle and doctor, it was something I really wanted to look into, and also it just seemed like a fun job. He never seemed to complain. He always had fun. He looked forward to going to work. So seeing that and just seeing, okay, this is someone I grew up seeing. He's like my grandmother's brother, but just seeing that and seeing it almost in-house, it really made it to where it was a dream I wanted to look forward to.
I would like to become an OBGYN because the mortality rate of Black women is high in their field, and I hope to accomplish lowering the mortality rate for Black women. The day before I started my 4th grade year, my grandmother passed in front of all her grandchildren, and I feel a little helpless. I was like, I feel like I could have done something about it, so I blamed myself for a while. And that's when I decided, well, I'm going to be able to do something about it next time.
I hope to open my own OBGYN practice in Texas. I was 5 when I decided I first wanted to become a doctor, but it wasn't until I was 7 when my little sister was born when I decided to become an OBGYN. I think it was kind of just the whole entire setting of the pregnancy of my mom, the checkups, birth for my sister, and also kind of talking to the doctor while she was in labor.
Although I'm not completely set on the specialty I would like to choose, right now I'm leaning towards orthopedic surgery. But either way though, whatever specialty I choose, the main goal remains the same, which is just to help people and make a positive impact on my community and the people around me. I would say the main thing that influenced me was growing up around a family of physicians. Both of my parents are physicians, as well as several other family members. So I would say that was the main influencing factor. I don't think it was a certain person or event. But when I look back and when I was deciding things like majors and things like that and where I might want to go with my career path, I really didn't see myself doing anything else besides medicine.
I aspire to be either an anesthesiologist or an obstetrician and gynecologist because I want to provide affordable health care for people who are less fortunate in our community, particularly Black women who have a 3 times more likely rate of dying during childbirth than white women. And I also believe that starts with looking at the solutions when it comes to cultural and historically barriers and providing representation in the field of Black women as doctors. I was 11 years old when I decided I wanted to become a doctor. It started with the formation of Honest Healthy Sweets, my cupcake business, and that's because I had a friend who was diabetic and she couldn't have brownies, and I wondered why. And I did research, and that's how I started my cupcake business, providing cupcakes that are healthy and cater to dietary restrictions and needs, but also taste good.
I aspire to become a dermatologist. I hope to establish my own private practice, and I also want to dive into the kind of business side of it too. I want to maybe establish my own line of products. I don't know about the program from Mom, who found out from Craig Mines. And I chose TSU because I always wanted to get to a HBCU either way. And then the mix of a full ride, the accelerated program, guarantee in a medical school, it was just perfect for what I was trying to do.
I aspire to be an OBGYN, and my accomplishments as far as that, I would like to open my own practice. I was about in 2nd grade when I decided I wanted to be a doctor. The event that influenced me to become a doctor was when I went to work with my mother one time. She worked in the medical field at an HR, and I got the opportunity to work with one of the doctors she worked with, and I wanted to be an OBGYN ever since. I was actually committed to going to Xavier University of Louisiana in New Orleans, and about 2 weeks before I was supposed to move to New Orleans, I got a phone call from like a family friend saying that they knew somebody, and it was Miss Murrow, and they asked me to come on a tour, and I'm doing my tour, and they told me about the Dr. Levi Watkins program, and 2 weeks before I was supposed to go to Xavier, I ended up switching and coming to TSU.
I aspired to become a pediatrician and work my own practice at my mother's old dental center in Hardyville, South Carolina. I decided to become a doctor when I was about 16. It was mainly because I've been participating in summer programs in Meharry and in Clemson that opened my eyes to different opportunities in the medical field, and that's what got me interested.
I aspire to be an anesthesiologist, and I hope to accomplish getting more people better treatment, because in smaller towns, they not get the treatment that they deserve. I decided to become a doctor at around 11 or 12, but I became more passionate about it in the recent years because my mom has multiple sclerosis, so she's kind of been in and out the hospital most of my life, and so I've seen where we were in the suburbs, and she had amazing treatment, amazing doctors, and back in a small town where she kind of had terrible doctors who didn't know how to read what they were looking at and stuff, and I just want to fix that gap. So we came in together. When everyone leaves campus during the summer, we're still going to be the only ones here, so you always have someone to fall back on.
I'm aspiring to be a pediatric dentist, and I hope to own my own practice one day. It was around the 2nd and 3rd grade. My brother had braces, and he would pick his brackets off. So it was a lot of trip to the dentist and orthodontist, and I had some good experiences there, and it was a lot of good vibes, and that's when I decided I want to go into dentistry. I enjoy a sense of familiarity between the other cohort members, and it really feels like we're going to be together for a long time, so we're going to be close friends.
A little history about the white coat and an introduction. From a post by Scott Harrah, he references an article by Dr. Mark Hochberg. This was published in the American Medical Association Journal of Ethics. And it states that up until the late 1800s, doctors wore black, similar to priests and other clergy members at that time. Now, keep in mind that black attire was and is still considered to be a formal and serious color. Physicians wore black for patient interactions at that time, since medical encounters were thought to be serious and formal in the 1800s. Now, another thought is that, or possibility about black, is that those encounters at those times with physicians rarely benefited the patient. Hochberg mentions that the change may have taken place in 1889 when a painting by Joseph Akins appeared of Dr. Hayes Agnew wearing a white coat performing surgery with 2 of his assistants. This image displayed doctors as being clean, sanitary in their white coats and attire. The white coat ceremony and reciting of the Hippocratic Oath signifies entrance into the medical and dental fields, where students learn and display extremely high levels of professionalism and empathy. The physician's white coat is viewed as a symbol of medical excellence. Today, Our white coat ceremony and oath signifies our students' commitment to excellence in preparation for medical and dental school, and most importantly, honoring the legacy of Dr. Levi Watkins, Jr. Would white coat presenters please come to the front of the stage? We also have some parents who are physicians, Dr. Gardner, Dr. Edward Lord, Dr. Don Lord, Dr. Adria Guest, and Dr. Ken Anile. We'll now have Dr. John Robinson with the introduction of the Dr. Levi Watkins Jr. Meharry Medical College cohort.
Good afternoon. I'm here to introduce the Meharry Medical College TSU Accelerated Pathway Scholars. In this group, we have 8 that are on the medical track, and we have 2 that are following the dental accelerated pathway. And so as I call your name, please come to the front and in front of the presenters. First, Ms. Naya Buck. Mr. Christopher Creighton Mitchell. Zaire. We have Anna Dochukwa Anelli. My Anna. Mr. Chance Evans. Mr. Grant Guess. Ms. Miracle Hughes. Amari Johnson. Ms. Amari Johnson. Mr. Ethan Lord. And our 2 dental Meharry TSU Accelerated Scholars, Mr. Gabriel Satchel. And my homegirl from North Carolina, Miss Jaden Webb.
Scholars, would you please repeat after me? We, the members of the Dr. Levi Watkins Jr. Scholars class, pledge to strive for excellence in our preparation for entrance into medical and dental profession. We pledge to be lifelong learners and to remain current with the changing trends in the profession, diligently preparing our minds and bodies to provide care for the underserved. We pledge to serve as a symbol of justice and equity in the healthcare community by removing the barriers and repressive structures that affect the underserved and minority communities. Most importantly, we pledge to honor the legacy of Dr. Levi Watkins Jr. and his mission of providing health care with integrity, empathy, and compassion for all. Thank you. You guys may be quoted. Okay. Thank you. Would the presenters remain here for the next group of students, the healthcare scholars? Thank you. We will now have the introduction of the Dr. Levi Watkins Jr. Healthcare Scholars by Dr. Sharon Peters.
I now have the pleasure of introducing our healthcare scholars. Jordan Johnson, Lauren Gardner, Chandler Hollins, and Kaylin Stewart.
Okay, presenters, would you go ahead and place the coats on the students first? Scholars, would you please repeat after me? We, the members of the Dr. Levi Watkins Jr. Scholars Class, pledge to strive for excellence in our preparation for entrance into medical and dental profession. We pledge to be lifelong learners and to remain current with the changing trends in the profession, diligently preparing our minds and bodies to provide care for the underserved. We pledge to serve as a symbol of justice and equity in the healthcare community by removing the barriers and repressive structures that affect the underserved and minority communities. Most importantly, we pledge to honor the legacy of Dr. Levi Watkins Jr. and his mission of providing health care with integrity, empathy, and compassion for all. Thank you. Now we will have congratulatory remarks by Dr. Artenzia Young-Sigler, Dr. Sheree Farmer-Dixon, and Dr. Edith Mitchell.
Good afternoon, everyone. Good afternoon, everyone. Excellent. I am Artenzia Young-Sigler. I'm actually the department chair of the Department of Biological Sciences here at Tennessee State University. I have been given the honor of offering congratulatory remarks to not only our scholars and white coat recipients today, so I want you guys to stand. All of you who received your white coats today, please stand. Give them a round of applause. Excellent. Now, if you are wearing a white coat, I want you to turn around and look at your family because you did not get here alone. And I want to congratulate all of the family members who are here today to witness this ceremony because I know it took a village to get these recipients here this far. So I want to congratulate them, but more importantly, I want to congratulate you, and I want to congratulate the program administrators that are up here today for everything that they have done to help these scholars along their way. So as the Department of Biological Sciences chair, I just want to say congratulations. It is an honor for me to see you, and thank you very much for sending these scholars our way.
Now we'll have remarks by Dr. Edith Mitchell.
Thank you very much, and thank you for the opportunity to have comments today. So, a few years ago, actually more than a few, I was entering Tennessee State University as a new student, looking for that opportunity to proceed further into a career in medicine. I went through this. It worked out perfectly for me, and later graduating from the Medical College of Virginia. Thank you. And it has been such a privilege for me to give back to TSU because Tennessee State University allowed me the background, the area to move ahead in medicine, and consequently, as the chair of the Dr. Levi Watkins Jr. Institute, it is my privilege as the chair of the advisory committee to be here today, to be able to give comments, and to thank all of the individuals who are involved with the implementation and structure of this program, both from Meharry Medical College, and Tennessee State University. This is a unique program in this country, and it's so important because as we look at the number of practicing Black clinicians in this country, it's less than 5% of all practicing clinicians. While we know that the census shows us that Blacks are about 13% of the population of the United States. And consequently, we have to work with our committees and our communities to make sure that we all have access to good health care, access to good medicine, so that we can take care of our families and our communities. So for the scholars who have donned the white coat today, you are a part of a profession. And consequently, we look to reach back, stimulate others to join, so that we have a continuous, I don't call it pathway, but I call it stair steps to getting to the next level. Congratulating the parents and other family members who are here and are part of this event. We're very appreciative to TSU, Tennessee State University, its board members who are here today, the Dr. Levi Watkins Advisory Committee board members who are here today, and our faculty and staff that have put so much effort into development of this program. So I'd like to ask all of the staff, all of the faculty of Tennessee State University, board members who are here, family members who are here, let's all stand and give these great students our round of applause. And now let's have the students stand. Everybody stay, keep standing. We are all in this together. We are all building healthcare in America and healthcare in our communities so that we will all be healthy in the future. And as you've heard from our speaker, today, not losing so many individuals, not only in health care and perinatal care, mothers and babies, but name another area of medicine, we're all low and have the worst overall survival rates. So it is so good to see everybody interested in increasing the status of healthcare in the Black community in America. Thank you so much.
Now we'll have an introduction of the Dr. Levi Watkins Jr. cohorts 1 and 2 by our program coordinator, Ms. Lolita Hodge.
Thank you, Dr. McMurray. As you can see, we have more than just the white coats adorned on today. We're also presenting to you the other two cohorts that we have, cohort 2 and cohort 1. I'm really excited. The 3 years, they say time flies when you're having fun, and it has been fun working with these students. And just to think, cohort 1 will be leaving us soon. So this is bittersweet. They're getting close to the finish line. Cohort 2, represented today, is a unique group. They have different area of specialties, so when I call your name up in your specialty, just come to the front, please. Mr. Thomas Huff, primary care and family care. Come to the front, please. Mr. Ashton Jackson, oncology. Caitlin Skates, anesthesiology. Sierra Smith, anesthesiology. Lauren Smith, obstetrics and gynecology. Kendall Rucker, internal medicine. Jemiah L. Gordon, infectious disease. Kendall Jackson, pediatrics. Agazori Mbeke, neurosurgery. James Jeter, internal medicine or cardiology. Journey Brinson, surgery. Robert Blaylock, anesthesiology or radiology. Tyler Vasquez, neurology. Frederick McGavick, primary care. Gavin Gibson, dentistry. Anaya Johnson, obstetrics and gynecology. Let's give our cohort 2 a round of applause. Daniel Johnson. Sorry, Dan, you were sitting back on with the cohort 1. Primary care, family care. Would you give our cohort 2 members a round of applause, please? Thank you. You all may have a seat. Cohort 2. Cohort 1, when they came in, we always say that we were building the plane as we were flying it. Some things we've had to tweak along the way, but I really appreciate the opportunity to work with them, to watch them grow. They have matured so since they've been here. They used to come in the office a lot because they needed us a lot. Now they kind of know their way and they try to help the others find their way, and we appreciate that. We're going to ask you all to come up This will be your last white coat ceremony participating with us, but we will be at your medical school seeing you receive your other white coat, hopefully next year. Samantha Altadort, Alan Bethea Jr., Taylor Brown, Sean Chesney, Kayla Davis, Dakota Elliott, Xavier Irves, Zaria Foster, Camille Haskins, Jamari Jemison, John Kim, Jaden Knight, Brooke Major, Micaiah McCrary, George Pickens, Ashton Terrell, and Ryla Traylor. This is the class of 2024, the first graduating class of the Dr. Levi Watkins Jr. Institute.
We will now have recognition of the Dr. Levi Watkins Jr. Society members by Drs. Kimberly Cooney and Joshua O'Hare.
Good afternoon, everyone. I'm Dr. Kimberly Cooney. I serve as one of the co-advisors to the Dr. Levi Watkins Society, along with my co-advisor, Dr. Joshua O'Hare. So the Dr. Levi Junior Society is a society of organization on campus comprised of undergraduate students, traditionally biology majors on a traditional four-year track. They matriculate through and try to maintain at least a 3.4. And so thank you on behalf of the Dr. Levi Watkins Junior Society. We want to say thank you for coming here to celebrate our students.
Hi, I'm Dr. O'Hare, one of the co-advisors for the Dr. Levi Watkins Junior Society. I'm here to announce our officers. So when you hear a name, will you please stand? First of all, our president couldn't be here today. She is tied up in some homecoming events. So our president's name is Jasmine Wall. We'll give her a round of applause. And then our vice president, Alaska Humphreys. Our secretary, Jalen Smith. And our treasurer, Sierra Jones. And with the rest of the society, would you please stand? And let's recognize all these hardworking students here, please. Thank you very much.
And we also want to note that Miss Tennessee State University Victoria McCrae is also a member of the Dr. Levi Watkins Junior Society. We would now like to acknowledge and give Dr. Douglas Allen, the VP of Finance, an opportunity to have a few remarks. He's an extremely big supporter of the program. Dr. Allen.
Good afternoon, everyone.
At this time, I would like to acknowledge excuse me, our TSU Board of Regents members in attendance. I would ask that they please stand. Our Board of Trustees members, Dr. O.B.L. McKenzie and Dr. William Johnson. I will ask that all members of the President's Cabinet please stand, along with the Faculty Senate Chair and also the academic deans. I will ask that all members of the Levi Watkins Advisory Board please stand. I will also ask that all members of the TSU Foundation Board please stand. Last but not least, our homecoming chair. Are they in attendance? Mr. Grant Winrow. He's in the very back, folks. Again, students, these are great accomplishments. I'm glad that we here at Tennessee State can assist you all, and we wish you the best in your futures. Thank you.
Thank you, Dr. Allen. We'll now have special presentations by Ms. Lolita Hodge.
We just wanted to do a couple of special presentations. I'm going to ask Ms. Hopkins and Mr. Thompson if they would come up here for a moment. You can, one package is over there and this down here, Reno, to bring that up there. And Shirley, see, I hung them up on the back. I'm going to ask the representative from Cohort 3 to come up on the stage to make the presentation, please. The two people from Cohort 3. Come up. The first presentation is up here. Thank you. This is our third year doing that. It's a bittersweet moment because Dr. Glover has been in our corner and we just had not gave her her white coat yet. So since she's decided to do another life after this year, we're going to ask Dr. Glover to come forth. Dr. Glover, I contacted St. John and I tried to get them to design the white coat. They said it's coming soon, but until then, we wanted to give you this one. I'm going to ask the representative from Cohort 2 to come at this time. Dr. Glover, we wanted to make sure that you had everything when you leave here to keep us in mind so you can continue supporting us and writing those checks. So Cohort 2 have a presentation for you. We're going to give you your blue coat, which represents the Dr. Levi Watkins Jr. Institute. No, you can't put all of them on at once. No, we'll fix it. We'll fix it. No, it's not. You can take She's gonna put it on. So you will always remember we love you, and we want you always to represent wherever you are in life. You can always wear these. Thank you. Cohort 1 representative, Dr. Glover, you can be seated now. Cohort 1 representatives, we're going to ask you to come forth at this time. Ms. Merle, we're going to ask you to come forth at this time. She can't stand this. Ms. Merle, we're going to ask you to come forth at this time. Now, she is so humble. She hates surprises, and for us to, this is truly a hard effort for her. But Cohort 1 wanted to give you something because it's because of you that all of them are here. The phone calls you made personally, the time and effort that you put in personally every day, she does not stop. We can't keep up with her. But I want you to see that this is something for you to remember Cohort 1 from. Your initial first hard work, and the inscription, I don't have my glasses, come just a little bit closer so I can read it. It states, your dedication to the legacy and mission is truly inspiring. Sincere gratitude for your service and leadership. Dr. Levi Watkins Jr. Institute, Cohort 1, Class of 24. And before Ms. Merrill comes up here and speak, we just want to, again, publicly thank her for all of her hard work, the hours and hours that she puts into doing this. Like I said, it's a heartfelt, she makes it easy. She doesn't make us work. We want to work hard because we want to show her that we appreciate everything she's doing, not just for the students, but for the staff. It's always a learning moment for all of us. It's not a day that does not go by that we don't learn something from her. It's not just how to handle people. And sometimes, you know, nerves can be short, but she'll make you calm it down and say it in a different way. Do you really want to say it like that? Do you really want to do it like that? And be like, no, I really don't. So she's a great asset, and believe you me, she is always, always in the student corners, always, always. Her first thought is, you know, how is this going to affect the students? What do we need to do to make sure the students have what they have? What do they need? Who do we need to call? What are the resources? Let's buy it, let's get it, let's do it. And she truly wants you all to succeed, and I truly believe that you are going to succeed, and no matter where you go in life, I'm sure that you will never forget the input and the impact that she has had on you. Ms. Merle.
I cannot remember some times in my life that I've been brought to tears. So this is a unique experience. As I look here at one of my first SGA presidents in 1966, Mr. Obie McKenzie, would you just stand? To my new students in 2021, 22, 23. Just a sidebar to say that I am happy that I think I made a phone call to everybody sitting here to encourage you to come to Tennessee State. Whoever I call, raise your hand. I just want to see that. Okay, I just want to be sure. So I thank you for making your trail to Tennessee State University and what you've brought to the university and what you're going to bring to our nation. And I truly believe that. And I thank you for this honor, for this picture, and the opportunity to work with you. And it was a labor of love to call all across the country to find all of you and to finally convince people like Ms. Stewart 2 days before she's going somewhere else to change her mind and come to Tennessee State University. So thank you all. So it is my pleasure to thank each of you for your presence and support of the Dr. Levi Watkins Institute, where we are the cure. These young people you're sitting here now, I truly believe will make a contribution. And their contribution will be increasing the number of physicians and dentists from underserved communities. Congratulations to Cohort 3, who now have your white coats, a symbol of their commitment to this program and to the medical and dental profession. Congratulations. Congratulations to Cohort 1 and 2 for their success on your journey to medical and dental schools. Congratulations. And then congratulations to Cohort 1. You started off with us. We grew together. We made it through to this day together, and we're going to medical school together. You will be making your transition from Tennessee State University this year. We have commitments from Meharry Medical College, also Sidney Kimball Medical College and Jefferson University in Philadelphia. And we look forward to others being announced. We welcome our parents. And can I have all the parents to just stand? I want to see this group, this crowd, see the parents who are here today. Thank you. And as Dr. Young-Sigler said, you brought them and you let us have them for a few while. And we're going to move them on to the next level. And we thank you for your participation and your presence here today. I'd like for you to know that this program is being live streamed, and each parent received a letter saying that we wanted them looking at you, each of you, when they came forward today to be announced. So while parents are not here, we have parents across the United States looking for you to be happy about where you are in this program. I'd like to also invite or welcome some of our people to stand. Our partners from Meharry Medical College, would you stand? Representatives of Meharry Medical College, would you please stand? We recognize our partner, Sidney Kimball Medical College of Jefferson University in Philadelphia, who is with us via live stream. So let's give them a round of applause. We recognize our corporate sponsors who are listed in your program today. Please take a moment and look in your program and thank you and say thank you, and look at the support that you have from corporate America. And it's coming every day. I'd like to also express my expression of gratefulness to Dr. Annie Marie Garraway, sister of Dr. Watkins, for her support and contributions to this institute, and for presenting the idea of the memorial in honor of her brother, Dr. Levi Watkins, Jr. We are grateful for the friends of Dr. Levi Watkins, also who contribute daily on our page with the foundation. So we're grateful for them as well. I'd like to also introduce, by having them stand, another medical school coming one day. And I see that I got a handshake, so Belmont University Medical School. We are so grateful to have you present today. And you were with us last year, absolutely, and you're here again. So thank you very much. So to everyone here, and to everybody on the stand, and to our illustrious speaker who gave such a great message today, we are so very grateful. Thank you. So I'm excited for what we have become. I'm excited for the future, and I'm excited for what these young people are going to do in the future as well. Thank you very much.
Thank you so much. That concludes our program today. Thank you. Oh, we're going. Oh, I'm sorry. We are going to sing the alma mater before we leave.
If we would remain for a moment so we can sing our alma mater. It is homecoming week. Are you not glad to be here during homecoming? Okay. In the land of golden sunshine, by the Cumberland's fertile shore, stands a school for greater service, one that we adore. Alma mater, how we love thee, love thy white and blue. May we strive to meet thy mandates with faith that's true.
Go Big Blue!
Is the cake is back here?
It's what you call it?
Thank you.